Good morning and happy Father's Day, or happy Father's Day, happy Veterans Day. I was thinking about my dad, so I said Father's Day. Happy Veterans Day. I'm a veteran, and to all you veterans out there, happy Veterans Day. Make sure you get your freebies. I've already had a Starbucks, so I'm chattering like a chicken here. Um, I'm going to read a short disclaimer. I'm going to say a few sentences, and then we'll talk to Dr. Tressa Pinkleton, our guest from Seattle. Good morning, Dr. Pinkleton.
Good morning, John.
And we'll get her expertise on exercise and why it's so important, especially to those on the Coimbra protocol. This interview is from our own personal experiences, and we are not talking in specifics, but in general about our experiences while doing the Coimbra protocol. We are not giving medical advice or addressing individual cases. Cases and results can vary using one method or another. Medical protocols and methods of treating MS should be done with a licensed medical professional. My dad was Lauren L. Otwell. He was 54 and he had a massive heart attack. So he decided he would take up walking. By the time he had passed away at the age of 82, he had walked 10,300 miles. When he was 75, he walked 23 miles on his birthday. And I asked him why, and it's like, I don't know. He's like, I just did. And he actually that day he planned on walking about 13 miles, and he was going to walk to a cafe and have breakfast. And he was cresting a hill, and he said, I got this sinking feeling in my stomach because it was Monday that maybe the cafe was closed. And he got there and he said, sure enough, the cafe was closed. So he did what any other sane man would do. He walked 11 miles to the adjacent town and got a hot dog and a Pepsi. And he said he walked from the place of his birth, which was Pearl, Illinois, to the place of his death, which was Pittsfield, Illinois, which was 23 miles. But when he died at 82, my dad was an author. In the latter years of his life, he had written 3 books. He was going to write a 4th, and he never got the opportunity to do it. But the 4th book was going to be about the importance of remaining physically active. And I can say my father walked out of the hospital on his own power, under his own strength. And 15 days later, he died of cancer. And he was still in great shape upon his death, except for liver. And I just saw through the years how my dad stayed active, and it really benefited him. How, my other relatives have drank like a fish and died at 82 and never exercised a day in their life. But I still think that you should exercise. It's good for you and keeps you limbered up, and there's a lot good about it. Anyway, Dr. Tressa Pinkleton this morning, our guest, is going to address exercise and why it's so important on the protocol. Again, good morning, Dr. Pinkleton, and thanks for being with us.
Yeah, good morning, John. Thanks for having me. So, I love that story that you just told. And yeah, exercise is so important to everybody. I mean, we could just talk for days about all of the benefits of exercise and the different types of exercise and why we need to exercise. And I'm very much a proponent of the move it or lose it, especially as we get a little bit older and more sedentary. If we don't keep our bodies moving, we start to have chronic pain and, all of those things that come with that. But with the protocol in particular, exercise is very, very important. And that's because, vitamin D at normal doses, right? Like what most people are given by their doctors or most people elect to self-prescribe, actually helps to make our bones stronger. It stimulates these particular bone cells called osteoblasts to pull in calcium and deposit into our bones. And also the vitamin D, as we know, increases calcium absorption in the small intestine, which helps us build stronger bones. And that's great. And that's why typically when somebody is diagnosed with osteoporosis, what they're told by their doctor is, hey, take some vitamin D. However, at high doses of vitamin D, which is what we see on the protocol, right? Those doses that can lead to vitamin D toxicity. What will happen is the vitamin D, through kind of this complicated system where that science, to the best of my knowledge, is still trying to figure out. Last I read in the research about 8 months ago, we're still not 100% sure why this happens, but high doses of vitamin D, a different set of bone cells are stimulated, and those are called osteoclast cells. And what they do is they break bone tissue down and they spill the minerals out into the bloodstream, right? So they contribute not only to a low level of hypercalcemia, which you can pick up in the blood work. If somebody's not exercising, I'm able to tell them their blood work, but also contribute to osteoporosis. And we've talked about this a couple of times on these videos, how osteoporosis is a huge risk factor of the Coimbra protocol. And it's something that I see, with some regularity in my patients who aren't doing their exercise, and also sometimes aren't eating enough calcium, which we spoke about last time. So that's why Dr. Coimbra, with the protocol, prescribes exercise. Now, there are different types of exercise out there, right? A lot of times when we hear the word exercise, we think of cardiovascular exercise, especially with women, running or the elliptical or biking or swimming. And that exercise is really, really important. It keeps our cardiovascular system strong. It increases circulation all over the body, helps to keep the brain sharp because of extra circulation in the brain. But what we need for the protocol is a different type of exercise. It's called weight-bearing exercise. And weight-bearing exercise basically is when you load the body up with weight and then you move it around. So strength training is my favorite form of weight-bearing exercise for everybody, especially for women, though, because we're often deterred from doing weight-bearing. And I do think it's one of the reasons we have a higher incidence of osteoporosis in our demographic, Coimbra protocol aside. So strength training, I love. Running and jogging are considered weight-bearing a bit, because as you hit the ground when you're running or jogging or doing a really vigorous walk, the weight of your body is hitting your skeleton, and that is stimulating those osteoblast cells. And what happens when we're doing the weight-bearing is that those cells, those osteoblasts, in a sense, feel that tension on the skeleton, and they don't want the bone to splinter. And so that's why they pull those minerals from the bloodstream and redeposit them back into the bone tissue. What is not considered weight bearing are things I listed before: the swimming, biking, the elliptical. Those things are primarily designed to take weight off of the body so that you can do lots of cardiovascular activity without feeling, like sore joints or what have you. And again, really important that we get good cardiovascular exercise in, but not protective for the skeleton while taking high dose vitamin D, right? So it's a thing that I counsel my patients a lot on. And, I try to get them to exercise 30 minutes a day, maybe taking one day off a week to rest, doing weight-bearing exercise. It can be as simple as having a couple sets of dumbbells at home and watching some videos. It can be as complicated as working with a personal trainer, which I find benefit, especially when you're first getting into strength training, to make sure you know how to move your body. For people that have issues with movement, who aren't as ambulatory as others, the MS Gym is a great resource to connect with. That gentleman, I've not actually had a conversation with him yet. It's on my list, a very long to-do list. But from my understanding, he has an MS diagnosis, and he used exercise to help heal and rebuild new neural networks around some of his lesions, which I think is just a great concept and something I do believe is possible. And so, I will give different options and try to point people to resources to help them. But it's a huge key component of the protocol to keep bodies safe and healthy while they do something like take high dose vitamin D.
Now, what about the vibration machine? This is what I personally used to do and have read. The
Mhm.
Russians, because of the space station in space, you don't put any weight on your bones. So the Russians developed the vibration machine for astronauts, and they equated 10 minutes on the machine to that of 60 minutes of aerobic exercise. Now, whether or not that is actually true, I never did any more research, but I can say this. I used to do 15 to 20 minutes a day on the vibration machine, and I simply loved it.
Yeah, actually, I was just looking into those types of machines for other conditions and have found some interesting research about them. In terms of the protocol, if what I tell people is if you can actually get up and move, if you can lift a dumbbell and do some biceps curls or hold on to them and do some lunges, do that. The dynamic movements, that's what our bodies were designed to do, right? And move it or lose it. I mean, I really
Yes,
believe in
move.
that.
Yeah.
If you are in a wheelchair or you can't stand or you have issues holding on to things, yeah, use the vibration plate if that's where you're at. And as you regain function, or if you regain function, then you can, elevate your exercise choice to something that might be a little bit more substantial. I have some of my patients that use the vibration plate, not a ton. And their DEXA scores, which are a DEXA is a kind of fancy X-ray that checks your bone density. For the most part, they hold stable. But I really prefer the idea of the dynamic movement. I mean, if you can get up and move, just get up and move.
Well,
don't
what
sit
I
or
tell
stand on the
people,
vibration
walk.
plate. Just get up and move. Like go outside, get that fresh air. Stretch. Like those things are so important to being a human being, and our lifestyles are already so sedentary, right? But in
Yes.
a pinch, vibration plates can help. Yes.
Well, I just encourage people to move, do something, walk. I don't care what it is, move.
Yeah.
Move whatever you can. Like Dr. Pinkleton says there, if you're sedentary, which I am, I'm in a wheelchair, and it aggravates the heck out of me. But I still get out the dumbbell, work on the pythons. Do that's a joke, by the way. Um, uh, do whatever you can and continue doing it, because I can tell you, I stopped walking the whole way. I used to have these handrails, and one day I fell down, and it scared me so bad that I decided I wasn't going to do that anymore.
Yeah.
Well, when I stopped, I stopped. It wasn't a week, and the ability to stand up and walk the hallway was gone. And that's the thing about growing older. Majority of people that get MS are middle aged or older. And you're going to find out that when you hit 50, things go away fast, real fast. I am amazed at how fast they go away. So you have to keep moving, whatever it is, keep moving. You have
Yeah.
any more to add to that, Dr. Pinkleton?
The only other thing I want to add is one of the reasons why this is, I mean, again, exercise is so important for so many reasons, but when it comes to the protocol, most people come to the protocol because they have an MS diagnosis, right? They have issues with mobility. A lot of those people with that diagnosis. And then if you do something where you're going to risk your bone density and you don't do everything to protect that, and you already have issues with walking or standing, you're at a higher risk for a fall. And if you're causing osteoporosis, you have a higher risk for a fracture, which will then
Yes.
really put you out.
Yes.
And so I just can't impress upon people enough to get this exercise in. And I've started pulling people off the protocol who aren't able to just do that for me, because I don't want to encourage an intervention that could have an outcome like that. I do see people have improvement in their bone density scores while on the protocol when they are doing the exercise. I know it's possible. I know it's possible to do it without high dose vitamin K, because I don't prescribe that in my office for reasons we've already discussed. So just, and if there's a problem with access or just like a loss of what to do, check in with your protocol doctor. There are so many free things out there. I want to put a shout out to one of my favorite websites, fitnessblender.com, a huge database of free workout videos that I direct all of my patients to. And you literally can go in there and search and say, today I only have like 20 minutes, maybe 35. I want to do lower body.
Can you say that again? I didn't catch all that.
Yeah. Where did it cut out?
Fitness.
Oh, fitnessblender.com. It's a website. Yeah. And they have a database of free workout videos, and you can, it's very specific how you can search in there. I love it. You can go in and say, let's say you only have 20 to 35 minutes. You did upper body yesterday, so you want to do lower body today. You can click that. You can click if you have equipment or not. You can click the level, and if you want to do strength training or something a little bit different, and then you click search, and I kid you not, there will be like 5 to 20 different things you can view for free that fit those parameters. I love Fitness Blender. It's just such a great resource, and don't be afraid to just try something new. And that's all I got to say about that.
Do something. That's what we have to say. Mm-hmm. Dr. Pinkleton, thank you so much for joining us again today and for these interviews. I can't thank you enough. And we look forward to our next topic, which is...
Oh, I got to think of that.
We don't know, do we?
I went on a little mini vacation over the weekend, and my brain's not in work mode all the way yet.
I had something the other day, and I don't know. I can't remember what it was, but we'll think of some. There's a ton of topics out there. Anyway, thank you again for joining us this morning. And again, to all you veterans out there, go get your freebies. A lot of freebies.
Thank you for your service, everybody.
Oh, and yes, thank you. All right. Well, I guess that's it. Take care.
You too.